I'm hanging out in my garage, just finished my workout, and I want to talk to you about weightlifting for women. So last week on my Instagram, I posted something, how important it is for women entering premenopause, menopause to weightlift, maintain muscle mass or build muscle mass, and put stress on their muscles and bones. There's a lot of information behind this, but I want to hit the fundamental basics. So if you've been thinking about getting into a gym, let's, build on this for ladies, especially 45 plus, and you're scared of a few things. For example, I'm going to get too bulky. I'm going to put on too much muscle mass. You're not sure how to do it. The gym can be an intimidating place. There's a lot of stuff in there. It smells sometimes. So I get it. But let's talk about some of those things, or I can maybe give you a different insight on that or perspective. And then we can go over some fundamentals for squat techniques, just one simple movement to get you started. So first of all, ladies, if you're 45 plus, to really jack up and put on that masculine looking muscle, 99% is not going to happen unless you have some sort of freak gene. And you'll need to lift really, really heavy for a really long time with some extra help in order to get that, meaning pills or injections. So first myth, I wouldn't worry about it. It could be intimidating. Yes, definitely. This is where we're going to work up our courage and go with a friend or go with someone that you feel comfortable with, or you might just need to take that first step of walking into the gym by yourself. So I get it. I've done it. I've been into many gyms. I'm used to it now, but there was that initial hesitancy at some point. Finally, certain movements can be intimidating. Let's talk about the squat. If talking to a population that, I've worked with everyone, so maybe people with knee replacements, ACL injuries, meniscal surgeries, MCL, LCL, other like PCL, other knee problems, moderate to severe arthritis. I've worked with them all, and you'd be surprised how many feel better when they start squatting and deadlifting, especially my 70, 80 something year old women post hip or post knee replacement. So it is possible. Some things to keep in mind: injuries. If you have a knee injury or previous history of surgery, that could be affecting you today, even if that surgery or injury was 26 years ago. Ankles, same thing. If you've ever fractured an ankle, if you fractured an ankle and there's plates and screws, it could affect your mobility from left to right, which can affect your ability to squat. That's where you need a professional to look at you, but regardless, doesn't mean you shouldn't move. What we want to do is also maintain power levels. So as we age, everyone is going to lose muscle mass. It's inevitable. Okay, it's called sarcopenia. What we can do to offset that inevitable loss of muscle mass is to train under load. We don't start with load right away because we need our tendons, our muscles, our fascia, all of our tissues, even our bones, to get used to load. So we start slowly, okay? Let's start with a squat. Let's start with just moving, learning how to do a squat. Now, a squat is important for helping to develop power. For example, when you get up off of a toilet, we have to squat down first. Getting up off of a couch. Power is important if we want to run up a flight of stairs, or racing to the front door if it rings, or potentially having to get out of the way of a moving vehicle. Who knows? Okay, so power is very important and something we definitely want to work on. If it's not done correctly, so if it's not under load or done quickly, there could be pain or injury after that. So really what I would suggest is pay attention to some of the techniques I'm giving you and use a mirror or videotape yourself and watch it back, okay? So let's start. I'm gonna move this stability ball over. Well, first thing I'm wearing my weightlifting shoes, so I'm gonna take these off. I just finished my workout. Now, I work out in weightlifting shoes because it has a different shape to the shoe. There's a natural heel lift. That helps with some of my movement patterns and making sure that I don't hurt anything when under heavier loads. Okay, the best way to start to squat is to get something that can elevate your heels. So I start with a small weight, okay? It's about 2 centimeters, or you can roll up a yoga mat or use a carpet. Anything works, just something to elevate your heels. I've used textbooks in the past. I'm gonna place that down on the ground, and we are going to start standing on the weights, heels elevated, toes down. I'm gonna turn this a little bit on this diagonal, okay? Toes are not gonna be completely straight. We can start with that, and they're not gonna be too turned out. We can start with a natural, maybe 5 or 7 degree external rotation, or if you prefer, keep them straight. We won't be going too low. First thing we wanna do is learn to bend our ankles. Now, if you notice, as I'm doing this, there's a few things happening. My ankles are moving, okay, if I go sideways. My knees are going forward, but my hips aren't going back. You see the difference in the movement? Body tips forward versus body's upright, knees go forward. Okay? Just practice this. Actually, this is an exercise I will give to some of my clients to loosen up their ankles. Once we get used to that, we're gonna place our hands wherever you like, by your side, crossed over your shoulders, or behind your head. Once we get used to that, we're gonna control it. So there's a point where our knees won't be able to go forward anymore, and our hips will have to go back. So now you're going into a little bit of a deeper position. Okay, let's talk about this position. A few things to think about. First of all, if you're looking into a mirror, make sure you don't see this. You see those knees compared to the feet? We want those knees to be over the feet. It's going to feel like, we don't want them outside of the feet, we want them over the feet. It's going to feel like your legs and knees are going outward. That's okay. Use a mirror to see, are my knees in line with my feet? Okay. Step 1. Second point, as we go down, so my knees are in line with my feet, and I go back, am I sitting into my heels and rounding my back? Or am I keeping a nice neutral spine? You notice my spine shape doesn't change from here to here. Everything stayed pretty much the exact same. Here to there, nothing moves. This is pulled in, and all of the movement really is happening from here down. Okay? So there's our squat pattern. I want you to try that and use a mirror, elevate your heels. Afterwards, if you feel good, we can hold some weight with it. Maybe not this much, but we'll start to get into holding load. There are some questions about people with arthritis around the hands. A good tip for you when holding a weight, if you wrap a towel around it to give it a little bit of a wider grip, that maybe, depending if you have arthritis through here, could be a little bit more helpful for you for gripping. You do need to use more grip strength, okay? Working on that grip strength will probably be a good idea, but you know, we want to keep it comfortable for you. Again, this is going to vary person to person. I hope that going through some of this information is helpful. I want to continue talking about this and posting because, as you can tell, it's very important for me for women to stay strong, powerful, and independent as they age.